Hi, my name is Lori Heintzelman. I am a board member for the Colorado Foundation for Universal Healthcare. In our Sassy Healthcare Activist calendar this year, I am the April model, which will help me start off my story. So this is me from 2 years ago. And the backstory to this is that I am a 3-time cancer survivor, including most recently, 2023. And let me go back to the first cancer. I have been a mostly healthy adult, and 26 years ago I was diagnosed with colorectal cancer. I was 36 years old, I was in graduate school. There was nothing that would have indicated I should get this kind of cancer at this age. So it was a shock and a journey that was difficult. At the same time, my father had been diagnosed with an unusual cancer, and then in successive years after I went through treatment of surgery, radiation, chemotherapy, we realized there was something going on in my family. So I had genetic counseling and genetic testing and discovered that I had a genetic defect called Lynch syndrome. So I was cancer-free for nearly 15 years. And I knew, and I was, getting surveillance for this cancer because it has a genetic basis and it can recur. It also put me at risk for other related cancers. And so I realized how important it was for me to have health insurance for life, because I needed surveillance for life, because I'm at risk of these cancers for the rest of my life. I was cancer-free for about 15 years, and then another cancer cropped up in 2015, endometrial cancer, which is also part of the Lynch complex. During those years, my dad also had 4 of the Lynch cancers. One of my sisters, who tested positive for this defective gene, also had one of the Lynch cancers. And so, it became really clear to me that I was lucky. The first time I got cancer, I had health insurance through grad school. The second time, I had health insurance through my work. And then this last cancer, breast cancer, 2023, I had health insurance through my work. But what if I hadn't? There are any number of circumstances where I could have not had health insurance to begin with, lost health insurance, and there are years in my life where my healthcare expenses have been very low, very minimal, barely meeting my deductible. And this last treatment for breast cancer, surgery, radiation, chemotherapy, the billing on that, if I had had to pay it, was over $300,000. And so I kept thinking to myself, what would I have done if I did not have access to health care? So I've been a contributor, a supporter of the Foundation for Universal Healthcare for many, many years, and then joined the board a couple years later. And I guess some people would think, well, Lori, health insurance works for you, private health insurance works for you. And it has, for the most part, but there could have been any number of circumstances where I didn't have that. I could lose that. What about all those other people who were surprised by a cancer that was genetic, not due to lifestyle? What would those people do? It's not good enough for me that I have that access and somebody else doesn't. So I am an advocate for this cause to my death, whenever that is. I hope it's a long time before I hit that point. But this means a lot to me, and I want other people in my nation to have the kind of care that they need and they deserve.